Thank you for joining today's webinar, everybody, where we'll be discussing digital health in aged care, improving the resident transfer experience. So my name is Alice Kett. I'm a nurse and the Strategic Lead of Education here at the ANMF Federal Office. I'm coming to you from Wurundjeri country on a windy Melbourne afternoon, and I acknowledge that this is unceded Aboriginal land. I recognise Aboriginal and Torres Strait Islander people's continuing connection to land, water and culture, and thank them for their care of country. So the Australian Nursing and Midwifery Foundation and the Australian Digital Health Agency have partnered again to bring you another webinar in our digital health series. And this is really to further these discussions. As we know, digital health is a really emerging space, and really putting nurses, midwives and care workers at the centre of some of those discussions. So today's webinar will be recorded. We've got an hour in the diaries together, but we'll have about roughly 30 minutes of content and then time for Q&A. Our entire webinar series is available at anmf.org.au, and that's freely accessible to everybody. There you can access previous webinars, there's online learning modules, podcasts, and other resources for all things digital health. And again, please feel free to share these resources with colleagues and your networks. So we're joined today by our subject matter experts from the Australian Digital Health Agency. So I'll introduce Kaylee and Zach. So Kaylee Gambetta is a digital health educator at the Australian Digital Health Agency. Kaylee's held roles as a business manager in general practice and a project supervisor at a primary health network. She's developed a strong focus on project management, change management, and education for healthcare professionals. Kaylee's passionate about driving collaborative care and supporting innovation through training for healthcare professionals. And Kaylee is supported as well today by Zach Wood-Elba from the agency. So Zach is a physiotherapist specialising in, thanks Zach, acute hospital and emergency care. His experience in clinical education, simulation training and digital education, and is now working at the Australian Digital Health Agency, or ADHA as we often call it, as a digital health educator, developing and delivering educational content for clinicians and consumers. So Kaylee will be presenting for us today, and Zach will be keeping an eye on everybody's questions that we'll use in the Q&A function. So you won't have access to the chat function, but there's a separately labelled Q&A function that we'll use for our Q&A, and Zach will answer some as we go, but then we'll do a dedicated Q&A session at the end. So Kaylee's here to speak to you today specifically about utilising My Health Record in the transfer of aged care residents, or in our care of our aged care residents, but we'll talk about My Health Record more broadly. And I'm very excited to bring you their voices today. And as I said, at the end, we'll have a quick Q&A. Also at the end, today's session, we'll send all of our live participants, so people that are in the room with us, a quick 2-minute evaluation via email. And that's so we can develop and grow these sessions, so we know what is most helpful to you as our members and care workforce. So before I hand over to Kaylee, we've got a really quick poll that should appear on your screen in the next couple of seconds. And that's really to help us understand who's in the room with us. So it's just a 2-question poll. And then we should all be able to have a bit of an understanding of who's in the live session with us. And so the questions are really just about how familiar are you with using My Health Record, and what's your setting? So to tell us about the type of care setting that you work in. So it's just two multiple choice questions. And I think we've got some results. So I'm not sure if everyone can see that, but so over 75% of people have never used My Health Record. And 61% of the folk in the room are from aged care residential facilities. 3% are from home care, 18% are from community, and it looks like we've got 18% in short-term and respite, if that's not coming up for you. So without further ado, Kaylee, I will hand over to you. Thank you so much.
Amazing. Thank you so much for the warm welcome and amazing introduction. Can everyone hear me? Take that as
We've got you
yes.
beautifully.
Okay, amazing. All right, thank you everyone. So my name's Kaylee Gambetta and I'm from the Australian Digital Health Agency from the education team, here to talk to you today about digital health in residential aged care, improving the resident transfer experience. Before we begin, I wanted to do an acknowledgement of country. The Australian Digital Health Agency acknowledges the traditional custodians of country throughout Australia and their continuing connection to land, sea, and elders past and present. I am joining you from Darkinjun land and am so thankful to be able to enjoy the beautiful sea and land that I live near and excited to bring some education to you today. So this is our overview for today. We're going to be looking at the My Health Record, a case study, and looking at how what we are talking about is going to be applicable across residential aged care setting. And we're also going to have plenty of time for questions and feedback. I wanted to take this time to welcome and acknowledge anyone in the virtual room, I guess, who's joining us that's not working in the residential aged care setting. There is some information here that's going to be beneficial for all clinicians, no matter where you're working. So very thankful to have you with us today. Our learning objectives for today are to identify the sources of information contributing to My Health Record and how it can improve the sharing of health information. We're going to describe the practical use of My Health Record and its application within a residential aged care setting. We're going to explain the purpose of the residential care transfer overview, documents in My Health Record, and how they can enhance transition of care. So let's get right into it. What is My Health Record? My Health Record is a summary of an individual's key health information. It is personally controlled, which is a key element of the system. What this means is that an individual has a say as to what gets uploaded, what stays in their record, and who can see their record. Importantly, My Health Record is part of a national system, which means that individuals' My Health Record travels with them wherever they are and no matter which registered healthcare provider they are seeing. A patient's My Health Record is accessible at all times, including at the point of care by the patient, their representatives, and healthcare providers who are involved in their care. The record can be viewed and added to however, this is subject to access controls set by the patient. My Health Record is private and is protected via the My Health Record Act's 2012 legislation. My Health Record is secure through multiple layers of international best practice in IT security. For example, we have a cyber security team which monitors, maintains, and improves the system 24/7. Okay, now we are going to look at some examples of the documents inside the My Health Record. So there are different sources of information that can be entered into the My Health Record. If we look at the blue heading, healthcare provided entered data, which are clinical documents such as health summaries, discharge summaries, pathology results, and specialist letters. There are also Medicare sourced information, which includes Medicare benefits and Department of Veteran Affairs item numbers, pharmaceutical benefits scheme claims, Australian Immunisation Register data, and information recorded on the Australian Organ Donor Register, as well as My Medicare information. There is consumer entered data such as personal health summaries and advanced care planning documents. Lastly, we have documents that are shared with My Health Record, like care and support plans, as well as my Medicare information. We have highlighted in yellow the documents that may be more applicable or of interest to you, and that's the residential care transfer reason, residential care health summary, and residential care medication chart, which we will discuss in a little bit. So as you can see, there is a large number of documents available to you in the My Health record. And so to assist healthcare providers with easily finding the most relevant information, the system generates consolidated views, which are shown on this slide. These include the medical conditions overview, prescription and dispense view, medicines view, Medicare overview, immunization consolidated view, pathology reports overview, diagnostic imaging reports, and residential care transfer overview. While we're on this slide, I also wanted to talk to you very briefly about Share by Default. So currently, patients are delayed 7 days before they can access most of their pathology and diagnostic imaging reports that have been shared to the My Health record. Healthcare professionals have immediate access to these results, but with legislation passing in Parliament recently, mandatory uploading of pathology and diagnostic imaging is anticipated to commence in late 2025 and early 2026. Additionally, the current 7-day delay for patients accessing pathology and diagnostic imaging reports in the My Health record will be removed for most of the results and reports. Watch this space, there's lots of more information to come, but I just wanted to touch on that very briefly before we keep going. Okay, so we have been through, Caleb's very keen to tell you about his health journey, but we have just gone through the documents available in the My Health record. So I wanted to show you a short case study on how some of these documents and the My Health record are a part of the journey for a patient transferring from hospital.
Caleb Derrington is an 88-year-old male who was living independently at home until he had a fall and fractured his neck of femur. He was taken to hospital in an ambulance. Staff in the emergency department accessed Caleb's My Health record to gain an understanding of his overall health. In hospital, he had a total hip arthroplasty and remained under their care until he was ready for discharge. After consulting with his family, together they decided it would be safer for him to live in a residential aged care home. The nurse admitting him to the residential aged care home reviewed Caleb's discharge summary, medicines view, shared health summary, and immunization documents in his My Health record. The residential aged care home arranged a telehealth consult for Caleb to see his GP. During the consult, the GP prescribed some medicines and sent the prescriptions to his active script list. She then sent a pathology e-request for HbA1c. Caleb was pleased that he did not have to leave the home to see his GP. The pharmacist accessed Caleb's My Health record reviewing his medical history and medicines information to gain an overall understanding of Caleb's health and medication status. He dispensed the medicines from Caleb's active script list and the pharmacy then delivered Caleb's medicine to the residential aged care home.
Okay, so while watching Caleb's health journey, I hope there was a few moments for you where you thought, yep, that's helpful, that's going to benefit us and our patients. And just that was an example of how those documents can assist in a transfer from hospital. Now let's look at transfer to hospital from a residential aged care home. We have a few examples of some challenges that the residential aged care home staff face when coordinating transfers of care. That includes incomplete documentation, missing clinical records, paper copies, fragmented communication, and potential transfer delays. Of course, I can't see your faces, but I'm hoping you're all agreeing and nodding and saying, yep, every day. So we're going to look at the residential care transfer overview. The goals of this overview is to improve point-in-time clinical information to provide more effective and responsive transitions of care. This overview document is generated by the My Health Record system when a residential care transfer reason document is uploaded to the My Health Record. This document is viewable by healthcare providers. It captures the residential care transfer reason document, residential care health summary document, residential care medication chart document, which we will look at further on the next slide. Other shared health information that is already existing in My Health Record include Advanced Care Plan, Advanced Care Document Custodian, Goals of Care, Immunisation Consolidated View, Discharge Summary, and Shared Health Summary. Okay, so looking at the residential care transfer overview documents, it is made up of 3 main documents inside of it. The first is residential care transfer reason document. So this captures the reason for the transfer of the resident for this episode. It must be uploaded to trigger the creation of the residential care transfer overview in the My Health Record. The next is Residential Care Health Summary document. It's recommended to be uploaded with a transfer reason document, and the contents will be dependent on what is captured in the local clinical information system that you are using. And the last is Residential Care Medication Chart document. This is recommended to be uploaded with a transfer reason document also. So information is pulled from all of these documents and consolidated into the overview so you can see everything in one view, which you can see in our slide. You are able to click on the blue hyperlinks, which will take you to the original source of the document, which hopefully saves you time and makes it a bit easier to get a view of your patient's health at this particular episode. So next we're going to look at another document that is in the My Health Record that can be uploaded, which is an advanced care plan. It can be uploaded to an individual's My Health Record containing their wishes for future health and care. The individual can also upload an advanced care document custodian, which holds a copy of their advanced care planning document. This document contains the details of the contact person or organisation. Some software products used in residential aged care homes have the functionality to allow healthcare providers to upload advanced care planning information. Okay, so we've had a look at what My Health Record is, what some example of the documents inside of it, and how these can be beneficial for transfer to and from hospital. We are now going to look at some representatives. So these are 2 types of representatives, nominated and authorised. First, we will look at authorised representative. An authorised representative is responsible for managing the My Health Record of a dependent who lacks capacity to make decisions for themselves. An authorised representative has complete access and control over the person's record as if it was their own. They can view, remove, and add information, choose whether Medicare information is added to the record, choose which healthcare provider organisations can access the record, restrict access to specific documents within the record or to the entire record. They can add or remove nominated representatives, view other authorised representatives, and cancel the record to delete it entirely. An authorised representative must make reasonable efforts to identify and support the will and preferences of the person they represent. If the will and preferences of the person cannot be identified, An authorised representative must act to promote the person's personal and social well-being. Something to note is that a person can have one or more authorised representatives if they wish. Now we will look at the other type, which is a nominated representative. And nominated representatives are people that the My Health record holder or the authorised representative of the My Health record holder can invite to help manage the My Health record. This is a person they trust, and there is no limit to the number of representatives that a My Health record holder may have. Having a nominated representative is especially useful for older people who require assistance, people with disability, and people who speak English as a second language. A record holder or their authorised representative have complete control over what a nominated representative can see and do in the My Health record. What they have access to depends on the level of access they are given. There are 3 level options: general, restricted, or full access. A nominated representative with a general access level can view all documents except those that have been restricted by the My Health record holder or the authorised representative. They cannot give another person access to the record. They can't change the access levels for other representatives, and they cannot remove other representatives. They cannot make changes to the Medicare information, and they cannot remove documents, add information to, or cancel the record. So it is quite a difference between authorised and nominated representative. The application process to become one of these is via the Australian Digital Health Agency, and we can include a link after the webinar if you like for more information. Okay, so starting to wrap up the information, we want to make sure that we're adding value to your clinical practice. My Health Record is a great digital tool containing a range of information that can support clinicians, but you still may be wondering how it can add value to clinical practice. Access to medications and allergies information in the Medicine's View provides key information that can help facilitate medication reconciliation tasks. We know that this in turn plays an important role in reducing potential medication errors. Access to residents' medical history, for example in a shared health summary, can also help facilitate assessment for healthcare staff, saving them time having to collect the necessary information or having to rely on the resident's ability to be able to recall their medical history accurately. Remember that the My Health record is not designed to replace other sources of information available to you, but rather to enhance the information available to you and to complement your medical records in your facility. My Health Record is a great platform giving residents the ability to share information such as their advanced care planning documents, which clinicians can access to be able to understand and comply with their end-of-life care decisions. I wanted to also mention to you the My Health app. So the My Health app was developed by the Australian Digital Health Agency. It can be used by the My Health record owner or holder, as well as any authorised and nominated representatives they may have access to key health information in the record. This free application can be installed on a mobile phone and tablet, but please note it's not available on a laptop or desktop computer. Residents and any representatives they may have can use the app on their device to view information such as immunisations, medicines, and test results on their mobile phone. They can now also add information like emergency contacts, electronic prescriptions, allergy, and medicine details. The home screen displays several tiles that let them easily navigate the health information in the My Health record. So hopefully you are all in love with My Health Record now and want more information. So we have included some on for e-learning modules, on-demand webinars, software summary sheets, and YouTube channel. On the YouTube channel in particular, there are some great videos on advanced care planning and also a short video on My Health Record benefits in aged care. That is all the content so far. Is there any questions?
So folks, feel free to put your questions in the Q&A section of the chat. Zach has been answering a couple, which is great. I might actually raise one with you, Zach, for the recording to say, so one of the questions was, does My Health Record allow for upload of enduring power of attorney and guardianship orders?
Yeah, that's a great question. Thanks. I've been able to answer that one in the chat, but just to summarize what I said there, essentially, if the EPOA information is part of the advanced care planning documentation, then that can definitely be uploaded into the My Health Record, but it differs between all the different states and territories. So you'd have to check with your specific jurisdiction on how that's happening in your state or territory.
And it sounds like, Kate, from a My Health Record point of view, that authorised person that Kaylee was talking about, that it sounds like they would then sort of have full edit access within My Health Record. So maybe at the same time as submitting some of those documents, you could do that that bit with My Health Record, and then that with the Digital Health Agency, I should say, and then the person will be able to have access over My Health Record for who they're representing.
Yep, and also a document custodian can be added with the advanced care planning documentation as well.
Beautiful, thank you. Another question in the chat is, how do the transporting team get access to this documentation?
Yeah, I can answer that one. It's a trickier one. Essentially, if I'm assuming when we're talking the transporting team, it's going to be like an ambulance or a like a patient transport service. At the moment, it is difficult for the ambulance or a transport service to access the My Health Record. There are certain limitations in place. So if they have access either through the hospital system or if they have access through the aged care facility itself to the My Health Record, and they've got the correct provisions in place to be able to access this information for the purpose of patient care, then they'll be able to access all those documents and all those things that Kaylee's just spoken about. However, if they're more of a separate organisation, then at the moment a lot of those organisations cannot. However, the agency is definitely aware of this, and we're working on things to ensure that we connect the whole care journey in this picture. So keep an eye out for updates on that, and we're looking to work with the transport providers.
Thanks, Zach. I might give you a little minute to have a look at some of the other questions in the chat. And just to add to that, while you're reviewing those, something we discussed at a meeting with the agency last week was the use of My Health app there. And I know that with aged care residents, particularly, we wouldn't want to assume digital health literacy, but in that transport sort of middle part, if the resident is conscious and able to use their phone, someone might have been able to assist them, or they might have the My Health app on their phone, and then they would have access to that information as well, if it's not at the sort of point of dispatch or the delivery end, if you like. Now, Zach and Kaylee, would you like me to go to the next question, or do you guys want to have a look at those?
Yeah, you jump to the next one.
Yeah, beautiful. So the next question, great questions, thank you, team, is, does My Health app, can the user, for example, a relative, have access to the content in a language other than English?
That's a great question. I will have to just double check that one. I am not confident that there are many languages supported with the My Health app at this stage, but I'll do a bit more digging and I'll let you know.
Great, thanks, Zach. And certainly, again, another meeting that I was in with the agency last week, there was discussions about, I believe it's not available yet, but it's certainly being suggested a few different times. So another question is, as healthcare professionals, how do we ensure that the information in My Health Record is accurate and complete, noting that consumers can choose to hide this information?
Yeah, I'm happy to take this one. So yeah, let me just review the question here. So essentially, the My Health Record is a complementary source of information. It's not designed at the moment to be the primary ultimate single source of truth. It's complementary information to support you to have as much information about your patient or an individual as possible to help inform your care. So you're absolutely right that people can remove things that they don't want you to see, or they can remove access for certain clinicians for sensitive information or sensitive documents. So think of it for now as a complementary source of information to complement any other information that's already available in either your hospital system at that end or your clinical information system as part of your aged care facility.
Thanks, Zach, and I'll give you another minute to have a look at the chat and add a comment of my own to that. I think with how complete is the picture, I think as health professionals, that's something that we deal with always, that a patient or a client can choose what they want to share with us, and we would kind of take their, we can only work on the best information that people give us. And in terms of removing access, something for me as a clinician that uses My Health Record as a patient, I really like that extra security that I know that if ever I go to a hospital or something that I've worked in, I have the option to make things that might be more sensitive that I wouldn't want, necessarily people to have access to, but I might want them to have everything in an emergency, might be a little bit different. So I think it's swings and roundabouts. So I love what Zach said about see it as a companion to our usual handover procedures and an adit rather than gospel. Another question, Zach, is there a format requirement for the content on the aged care transfer summary?
So in terms of format requirement, I'm not quite sure what you're asking, but I can answer both ways there. So in terms of format, your aged care clinical software has My Health Record and the residential care transfer summary built into the back end. So it knows what information and where to pull it from your clinical information software. That's already been sorted. So when you want to upload that information, if it's pulling a summary of that patient, it pulls it from the appropriate parts of your software that's been identified by your organization and your software vendor. But then in terms of format, say at the other end, once the summary's actually all been put together, it's formatted as a PDF. So when, say, the hospital accesses the My Health Record through their electronic medical charts, then they would see that through their My Health Record portal as such as a PDF.
Great, thank you, Zach. I'll give you another little. We've got some access in the background. There's some great questions coming through, team. And while you're having a look at those, Zach, there's a couple of comments saying that would be great to have that access for ambulance services, and I think that's say it's coming, but I agree. In emergency situations, quick access to information is really important. I don't know if you like to read some of those out, Zach, or would you like me to?
Yeah, I'm just flicking through now. I just want to make sure that I can answer it as good as I can.
I might choose one while you're looking at those for Kaylee, if possible. Kaylee, we have a question. Is My Health Record used in all Australian states?
Yeah, absolutely. So the My Health Record is a national system available throughout Australia wherever the patient travels. So as long as the healthcare provider is registered, they can access it no matter which state they're in.
And do you mean registered with APRA or with My Health Record or both?
Registered with APRA, and then they utilize the individual health identifier, like I believe. They grab a number from APRA, and that's how they access My Health Record. So yeah, registered with APRA.
Beautiful, thank you.
Alice, I'm happy to answer the question from Belinda Fewings.
Yeah, okay. So Belinda's asked, given that many consumers that experience fluctuating mental states, if they experience with a background of severe and enduring mental illnesses and some psychotic states associated with the use of alcohol and other drugs, most individuals will refuse access to records. What is the considered view in relation to moving forward to support these individuals being assisted to see the value of this app?
Yeah, so of the app in particular, so we work in a general sense, the agency works quite closely with a lot of consumer peak bodies. We work with them in order to get, like we're doing now, in order to promote and talk about the benefits of the My Health app, the My Health Record, and we also play a hand in electronic prescriptions and all those types of things. So we do work closely with peak bodies. We work closely with the jurisdictions, so all the states, in order to try and build that education as much as possible. We can absolutely acknowledge that people's mental state and their reason for accessing a health service or accessing a hospital or whatever it might be might mean that they have some distrust in the record itself. If they've formally gone and opted out of the My Health Record, then that now is not available as a source of information for that patient in particular. So that's the patient's choice, and we respect the patient's choice, and you no longer have access to that patient's information. Keep in mind that the My Health Record is opt-out. So if they haven't opted out, then that information will be there and available. And registered health practitioners have the right to access that information if it's for the primary purpose of providing healthcare to that patient. So that information is available as long as the person has not put any restrictions in place on their record.
Thanks, Zach. And again, I think an important message to remind ourselves that we do still want to have patient consent as really an important part of how we do things, and that when we have other avenues like enduring power of attorney, like other representation that we can use if the patient is not able to consent. I think that would be a different avenue to using My Health Record for that.
I'm able to take David Gillick's question.
Beautiful. Okay, so David has asked, how does information get from the aged care home software into My Health Record? Does it have to be exported as a PDF manually?
Yeah, that's a great question. And I guess I'll preface this one with it depends on your aged care software and the clinical software, or the electronic medication management software that you're using. But the general answer to this is that what happens is that the My Health Record is built in, and with a few clicks in your software, you might go into like add a residential care transfer reason. Some software will have a drop down and you select what that reason is. Some software will have free text. So then you would enter the free text for residential care transfer reason. That would trigger the document to be created in the My Health Record. So that's automatically then created. And then normally, again, dependent on your clinical software, with a few more clicks, you can add you can tell your software to import your resident's transfer summary information. So it pulls key information from, say, the medical history, the medications that they're on, and whatever else is relevant for that patient. And it puts it into that summary in the My Health record, which is then a PDF version.
Beautiful, thanks. I'm very excited as a nurse for the concept of systems integration. I think that's so exciting and not something that we've seen much of in the past. So that's really great.
And I think the key thing here to remember is that the My Health record isn't in its final stage. You know, we're always going to be building on this and adding features. And if you look on our website, there's a lot of information about Health Connect Australia, which then talks about how we're actually building that interoperability between everything, between My Health record, to include the hospitals, to include the ambulance, to include the care worker that supports that person at home. And parts of the My Health record will contribute to that as well. And that's all part of our future plan and our future roadmaps.
Beautiful, thanks, Zach. And I think on that note, there's another question in the chat about how are we ensuring that ethnic populations understand what this is about, and awareness programs. And I think exactly what Zach's talking about, that interoperability. There's publicly available that you can review documents called a Connected Care Council, and a lot of things go through that then inform work and stakeholder engagement at that level before any of these decisions are made has been really engaged, and with particular peak bodies in areas of concern. So there's community services, there's been aged care ones, there's been one about rural and regional health access. So at that really high level, those conversations are being had quite early on for changes. Anything else you'd like in the chat, Zach? Or I shouldn't say chat.
Just heading through now. There's a few questions there. I guess just to build on what you're already saying there, Alice, with ethnic populations, the agency works quite closely with FECA. I'll have to quickly fact check the acronym there, but Federation for Ethnic Communities Council of Australia. So we work quite closely with them to ensure that our resources are accessible and able to be accessed by various ethnic populations as well.
Beautiful, thanks, Zach.
We've got a question there from Katrina Long. I'm happy to just read out the question. What's the current rate of data completeness of things like hospital discharge summaries when someone is transferred back from hospital to a residential aged care home? And how quickly is it uploaded at the hospital end? So what we're seeing and what we do and how we work with all the states and the territories and the public hospital systems is different for each one, as you can imagine. However, normally what's happening is that within their hospital electronic medical records, when a discharge summary is created, say someone's come into the emergency department and the doctor has written a discharge summary, in the back end, that discharge summary is automatically uploaded into the My Health record once it's been authored in that hospital's electronic medical records. So I couldn't say instantly, but essentially what's happening is that as soon as that's authored and complete from the hospital end, then assuming that their system is set up and accessing the My Health record and uploading appropriately, that's all been set up with us at the agency, then they will be able to see that information very, very soon after it's been authored from the hospital end.
And Zach, am I right? Like with pathology and diagnostics as well, in the past, there has been a delay for things like patient access in My Health record, and that's changing now as the system develops. Is that correct?
Yeah, absolutely. And Kaylee summarized that beautifully in her chat, in her talk as well. So essentially what happens now is that as a consumer, someone might not be able to see that blood test or those pathology results for 5 days. But now what this legislation, the share by default legislation, means is that that delay is reduced. So as soon as it's available on the My Health record, once it's been reported from the pathology or the diagnostic imaging, then that's available to the consumer as well. There are certain intricacies with special tests or quite sensitive tests where there is still a delay for the consumer. However, the specific details on that will come out as they're more publicly available.
Great, thank you, Zach. There's another question in the chat that I might take, that I might put to you is, can an individual only opt to use My Health record as a tool to get easily accessible medication script from the GP and medication supply from the pharmacy? So I think that question is possibly about electronic prescriptions. Could you just use it as e-script rather than as a medical record?
Sorry, was that for the My Health record or the My Health app?
That was for the My Health record. Let me just, My Health record. Oh, yeah. No, sorry, I've said that with great confidence. Yes, My Health record.
My Health record. So think of the My Health record and electronic prescriptions as two different services. Essentially, your My Health record, how do I answer this? Let's talk about My Health record to start with. That contains, all your medical information, and your electronic prescription, which has been provided to you from, say, your GP. That's obviously recorded in Medicare, so that information is available on the My Health record. But the way that you as an individual or your patient or whoever it is would actually access an electronic prescription is separate from the My Health record. So even if you're not using the My Health record altogether, your doctor can still send you an electronic prescription. You can still access that electronic prescription on either your emails or a text message to a mobile device, and you can still have that dispensed from your pharmacy using that electronic prescription. It doesn't matter if you have a My Health record or have opted out for My Health record. The My Health record, though, will display information on that medication from the electronic prescription record of when it was prescribed, when it was dispensed, and that similar information. Building on that again, you can use the My Health app to store your electronic prescriptions. So you would need a My Health record login to access the My Health app, but then you can use that to store your electronic prescriptions as well. So it's kind of like the app is starting to bring those two things together, but you can still use them separately.
Beautiful. Thank you, Zach. And certainly I know for me, that's how I use mine currently, is as my e-scripts I have a record of, and it's quite, I don't use, I will, but the My Health app yet. Anything else, Kaylee, Zach? We've got a question there. How many aged care facilities are using My Health Record? And I don't know if you'd have those exact numbers, but I don't know if you're able to then comment on default legislation and maybe how that will work.
Yeah, I can have a go at answering this one. So how many aged care facilities are using My Health Record? It's hard to quantify a number. The Australian Digital Health Agency has a conformance register. So if you look up Digital Health Agency Conformance Register and head to our website, you'll see a register there of all the software products that are conformant with the My Health Record. So that will tell you whether your software is conformant. So that's kind of that'll give you an idea. If I run some numbers off the top of my head, no, I'm not going to run them off the top of my head. I'm going to quickly look them up on our agency website.
And I think my impression is that gradually there's a bit of leeway at the moment for people to get online. So as it becomes as default, I'm not sure. I know this is how it's working for practitioners. I'm not sure if aged care facilities are different, but I think gradually there'll be more and more of a compliance requirement to get online, but there's possibly not necessarily yet. Is that fair to say, Zach?
Yep, that's fair to say. And what we have as well is we've got an industry offer out with aged care software vendors to work on having My Health Record and the residential care transfer summaries built into their software. So a lot of those are becoming conformant at the moment, and a lot of them are nearing conformance. So we can't actually confirm how many are actually conformant, because that is actually changing week by week. Some data that I do have is 45% of aged care facilities, no, 12%, 45% of aged care facilities have access to the My Health Record, and 12% are actively using and accessing the My Health Record. So although those numbers seem quite low, if we compare that to, say, general practice or pharmacies, which have 99% access, 99% using, it's because the actual functionality of using the My Health Record is only recently started to be built into the back end of this software. And we're seeing month by month this data, we're seeing increases in utilization. So we anticipate that's going to increase a fair bit as this more software vendors and the bigger players in terms of aged care software become conformant.
Beautiful. Thank you, Zach. Yeah, Zach and Kaylee, so if anyone wants to pop in any final questions, we're coming to the end of our time together, and hopefully people have access to a couple of the written responses in the chat too. But I'm wondering, Kaylee, Zach, is there anything else that you would like to comment on?
Only that the shares will be the shares, oh my goodness.
The shares will be slided. I knew what you were going to say.
Speaking in cryptic messages now, the slides will be shared in PDF format as well, and they include the phone numbers and email addresses that you can go to if you have any further questions for the Australian Digital Health Agency in particular, as well as all the other platforms where we have additional learning too.
Thanks, Haley. And look, as a clinical educator, folks, I'd really like to put a plug in to go, we've got the multimodal ed learning covered here, in that there's podcasts on the ANMF website if you're someone like me that likes to walk the dog or clean the house and podcast. There's e-learning modules that the agency have that we also have hosted through our website. There's other recordings of this, of webinars like these if you're more audio visual. So there are really a bunch of different ways to stay across the curve with the changes in digital health. And I would really encourage people to do that, particularly the e-learning modules, I think are really fantastic the way they're split up on the Digital Health Agency website, in that they're split by discipline. So you can look general nursing and mid, you can look into aged care, you can look into emergency, but things aren't exclusively filed. So if there's something that's relevant to you in aged care, but you're also a nurse or midwife, those e-learning packages appear in multiple places. So I would really encourage you to have a good play around the Digital Health Agency website and the ANMF digital health page on our website too, that has a lot of this information.
And one other thing, circling back to a earlier question, which I was unable to answer, which was the language support for the My Health app. So distinct from the My Health app, the My Health record has various language supports. A lot. You can look them up on our website, but the My Health app itself doesn't yet have all those functionalities. So, but keep an eye out, because the app's going through some, well, potentially going through some updates soon. So we're hoping to see those come into play with the app, but definitely the My Health record has language support.
Beautiful. Thank you, Zach. Well, we've come to a steady state. I see some thanks coming through the Q&A, which is lovely. And I will echo that, Kaylee and Zach. Thank you so much for lending us your expertise. It's really great to have you both in the conversation. And thank you on behalf of the ANMF and all of our members.
Thank you so much. It's been wonderful.
Great. Thank you, team.
Thanks for having us.
So much. Bye.